Hi, everybody. Welcome to our Wellness Wednesdays for Men's Health Talk today. Today, we're talking about erectile dysfunction, erectile issues for college men here at UCSD, and what that looks like. I'm joined by Dr. Michael McGlenn and from Counseling and Psychological Services. So if you would introduce yourself, that'd be wonderful.
Hi, everyone. My name is Dr. Mike McGlenn. My pronouns are he, him, his. I'm one of the postdoctoral residents over at Counseling and Psych Services. And specifically, I tend to work with folks over at Student Health Services in the Behavioral Health Department, where I see students who present for a range of concerns, including some of the concerns we'll talk about today with erectile and sexual functioning. But in addition to that, I work with students who are experiencing kind of low mood, maybe nervousness or anxiety, concerns kind of adjusting to college life, a whole range of things that I see folks over there for.
Gotcha. Thank you so much for that introduction. And just to kind of piggyback off of that, my name is Christopher Spurling. I'm a health educator here with Health Promotion Services at UCSD. Pronouns are he, him. I'm the men's health educator, but we also work on sexual health and other issues like that as well, including LGBTQ plus health. And sort of a range of things. For today's topic around erectile concerns for college men, I'd love just to start off with a discussion about what that looks like. What are erectile concerns, especially in this age group? What are some common things that you see with students, and just sort of how common are erectile issues when it comes to college men?
Absolutely. So when I think about when students come to me and they're presenting with concerns about erectile functioning, there's a lot of things that I want to know about. But before I get into that, kind of thinking about erectile concerns, we often don't talk about sex, especially here in the United States. It tends to be a taboo subject. So we think about how do we learn about sex growing up. Tends not to be the case where we learn about it in a really formal way. It's often not talked about. We often learn about from our peers or maybe from some of our own experiences early on. It is common for men, since we're talking specifically about folks with talking about erections, it's common for folks to have difficulty or have concerns about sexual and erectile functioning. And again, that's partly because we don't know what it is to be normal. It is common. It tends to be transient. It tends to come and go depending upon the situation, which I'll get into in a little bit. Where we have a little more concern is when the concerns with obtaining or maintaining an erection, or difficulty with having a rigid erection, kind of maintains itself across most sexual encounters over a prolonged period of time, right? It's common, it might be the first sexual encounter, you're a bit nervous and you're having a hard time getting an erection. That tends to be common, right? Most of the time that stuff goes away over time though. It's when it really sticks around for a prolonged period of time is when we're kind of getting more, want to address it in a way. For folks, we're kind of looking at the prevalence of what we say from a psychological perspective, erectile disorder, although, erectile concerns, I think is more appropriate, it's less common to have the persistent concerns with erectile function, where it lasts over a prolonged period of time. And it tends to increase with age, but it is less common within that college-aged population. So there are a number of biological factors. There's a couple of factors to think about, right? There are biological factors and things to consider, and there are also what we call like psychogenic factors to consider of what might lead to some erectile concerns, okay? Certainly cardiovascular concerns, if heart health isn't great, that might lead to it from a biological perspective. Hormones could be at play, could be off, neurotransmitters could also be concerned. Being overweight. So overall physical health is very important to optimal sexual functioning. So if you have any concerns with overall physical health, that's important to get checked up on with a doctor, as is with erectile functioning as well. I think it's always good to get a checkup. Kind of things to think about though, like if you're thinking, oh, is this a biological component or are there some maybe mental health components to it, is, are you having oftentimes what I ask students is, are you having nocturnal erections, right? So are you able to get an erection during sleep? Do you wake up with an erection? That's something that can be checked with a doctor too, if you're not quite sure. Most people at work tend to know, like, oh yeah, I'm able to get an erection at night. It happens rather regularly during the week. If that happens, tends to mean that blood flow is working okay. So maybe we're not as concerned about the biological perspective. Again, want to get that checked out though. And also too, if folks are masturbating as well, if you're masturbating, it tends to mean that you can get an erection. And so then we're looking at, okay, well, then it sounds like maybe the concern might be with sexual performance during the actual and sexual encounter itself. Okay. Also too, just on the biological perspective, substances can play a role. Substance use can play a role in sexual functioning. In lower amounts, students say, that they drink and kind of gives them some liquid courage in some ways. On small amounts, it may, because again, alcohol is an disinhibitor. So it might kind of take away some of that inhibition initially. So you might find that you're more interested in sex, but at higher amounts, and especially over a prolonged period of times, there can be some significant consequences for sexual performance. From a kind of psychological perspective, right? So if we kind of ruled out some of those other couple things that we've talked about before, now we're looking at what mental health factors might play a role. Tends to be the case, a lot of concerns related to depression can be a factor in things. Anxiety can be a factor, especially around performance. Certainly, of course, as well, trauma can be a factor as well. More commonly, I see that anxiety tends to be the real factor in why college-aged men are having concerns with being able to get or obtain or maintain an erection. We think about kind of how this happens, right? Maybe there's a first sexual experience, and maybe it didn't go the way that we wanted to, and now there's performance anxiety. And so now they're thinking about it more, and then it happens again, and then now they have worse anxiety. And now they're not initiating in sex going forward. Well, now that's going to maintain the problem going forward. Now they're not finding out whether or not the concern they have is true or not, right? And if we think about it just from a kind of a tool that for some men to take away that might be useful to think about this is, our ancestors were hunters, gatherers, and they, we developed a fight or flight system. We need that fight or flight system to work even today, right? A lot of our threats were external, had to go out and hunt for food, whatever that may be. And for that, we need that fight or flight system to work, right? We need, when faced with a threat, we need blood to rush away from our brain. We also need blood to rush away from our sexual organs and our digestive organs, go to our big muscles. We're going to increase our level of oxygen in our body so we can fight or flight. What that means then is that when we're in a state, in that autonomic arousal state, is we're not going to be having blood into our sexual organs. So we're not going to be able to perform well. Now at this point in evolution, we can think of threats that activate just as if we saw a tiger or a bear, and our body responds in kind, right? Increased heart rate, might be hypervigilant, increased arousal, increased heart rate, and also means that we're less likely to be able to perform sexually as well, too. Because again, blood's not in the penis. So with that, what I tend to say for students and kind of moving on to kind of what to do with that is it's important to notice what is the threat that I'm perceiving in the environment. Now, what is it that I think maybe my partner is going to think of me if I can't perform, or what is it that they're thinking, right? Oftentimes I hear students say, like, I'm thinking about all these different things and I'm not really present, right? Because there's a threat in the room, and it's important to recognize what is it that we're perceiving as the threat, and how can we reduce that threat? Is the way I'm looking at this potential threat helpful? Is it accurate? Is it true that they're going to think I'm a total loser if I can't get an erection or perform sexually? What is it that I think they're thinking of me? And I think it's important to be sure that we're addressing those worries as we're in that moment, catching those thoughts that might not be so helpful, and try to find ones that are more balanced. Like if even if I can't perform sexually right now, I think the person will be okay. I'll be able to work through it. It won't happen every time. You know, we'll try again in a little bit from now. These are things that are important to remind ourselves. Again, lower that threat level. Okay. Additionally, what I think is important is it's important for us to feel comfortable, right? We want to reduce the threat system. So part of that means connecting with the partner that we're with. Are we doing things to become more comfortable with the person that we're with? Are we getting familiarity? And so that's where something that's called sensate focus. Basically what it means is getting comfortable with the partner that we're with, you know, so oftentimes it starts out with kind of non-sexual touching, you know, petting, maybe we're laying next to each other and touching in a non-sexual way. Each person talks about how that feels for them. You know, what is that like? You know, I prefer this, I prefer that. And then the other they take turns, right? And then they touch each other and then move up to more sexual touching. And then from there, possibly into actual sexual activity. You know, so all throughout it, it's making sure that we're more comfortable at each stage. And from there, we're reducing the threat, we're increasing communication between partners, and then hopefully, again, addresses that level of threat. Also, too, I think it's important to remind folks is that, you know, oftentimes, at least speaking specifically for male-identified folks, is that the folks that I've worked with, it's been about, you know, intercourse is the ultimate goal to get to. And I think it's important to remind folks that that's not necessarily what's needed for things to be pleasurable as well. It can be pleasurable doing a number of different other sexual activities. And I think what's critical is finding out what's meaningful to the partner that you're with. And then one thing I think that's also valuable to think about is focusing on closeness with the partner over the actual sexual outcome. Oftentimes it's like the folks I've worked with, it's thinking about, we've got to get to this ultimate end goal. There needs to be intercourse. And I think what's important is let's focus on closeness. We're going to take an erection out of the equation. We're going to maybe take intercourse potentially even out of the equation. We're just going to focus, our sole goal right now is on focus on closeness and how can I be as close as possible with my partner. What I find is when that happens, what also tends to happen is now that we're getting closer with a partner, the threat is also coming down as well, which as a byproduct, we're not doing this to reduce threat per se. We're actually focusing on closeness because that tends to be, you know, very meaningful and pleasurable as well. But it also then, as a byproduct of it, tends to also reduce that level of threat. So I think that those are some important things for students that they can do immediately just to review, you know, noticing what the threat is, try to reduce that threat in your head. How am I interpreting this situation? Some of those communication strategies with the partner you're with, maybe non-sexual touching and then working up to more sexual touching until you get comfortable. And then again, focusing on closeness over sexual intercourse itself.
I think that's a really good perspective that you put on that. I think you said that very well, that sometimes intercourse becomes sort of like the pinnacle of what this experience should be like for certain people. There's a whole other set of layers to any sort of relationship with individual or individuals plural, where that can be part of that, but it doesn't have to be sort of the end goal or like the end point of where you're trying to reach. I think that when you put that sort of pressure on yourself to make that happen, that can also be part of that threat. And
yes,
school's busy enough. There's enough people doing all these sorts of things in school right now. And especially with this past year and a half, there's already plenty of stressors out there. And so taking the time to sort of maybe not have that sort of goal for yourself or not put that sort of pressure on yourself might help reduce that like general level of stress and threat that's out there that students might be experiencing as well. I think
also, one thing just to add off of what you're thinking, made me think of this, is it's important, you know, we're talking about one avenue of things, you know, sexual health. And as we've kind of alluded to, you know, mental health is health plural, right? Or just in general. And so the things that bring us joy, the things that bring us meaning, are important to us to do, right? We need to exercise regularly and do things that are good for our over physical health, right? That's doing something about sexual health as well. Doing things that make us feel close and connected with people that we care about, activities that bring us meaning and joy. Are we living a more holistic life? Because if we're doing that, then probably our physical health is probably going to be in better shape, but also so is our mental health, which is going to help in the sexual realm as well. So I think that's important for, by going out and doing exercise, you're also doing something for your sexual health as well.
Yeah, and I couldn't agree more with that. Of course, as a health educator, I agree with that. But I also think you brought up a really good point of bringing things sort of starting off in that sort of slower place of let's look at the basics here before jumping all the way into the more complicated parts of a sexual intercourse relationship. Because that even takes into account, yes, like for the person to feel comfortable and sort of reduce that stress, but also for the partner or partners need to be in that same level of consent, one, but also for being comfortable and aware and all those things too. And
Absolutely.
I think that starting off slow, I mean, that's even including things of having conversations around cultural differences about expectations and what's okay, what's not okay.
Yes.
I think having those conversations at the beginning, at least towards the start, helps create that, sort of sets the tone, I guess, for how to move forward in a collaborative way as opposed to just a purely sexually focused way, which could be very useful.
Yeah.
Then sort of off of that, as far as these tips you provided and these skills, I think are so useful. I think that sometimes we try to self-medicate or those sorts of things as well. So just a quick stat to put out there is we do the National College Health Assessment every couple of years. Last time that we had data come through that we're able to use right now was in 2019. So for that 2018-2019 school year. And this is all self-report data, but from the data that we have there, which has been generalized to the population, is that about 1.1% of UCSD men actually took ED, erectile dysfunction pills or medications without a prescription. So it's one thing to be under the care of a physician or someone like that to be receiving medication, but to sort of be seeking it out on your own and what that looks like. Medications are powerful things, and that should always be under the care of a physician or a prescribing provider. So I would definitely say be careful on that. I would definitely recommend never taking something without a prescription. But if it's something that's that concerning to you, it is a time to reach out for not just a physician to look for your physical well-being, but also for your mental well-being, reaching out for counseling, psychological care, whatever that looks like for you as well. And then, go ahead.
Oh, I was just, sorry. One thing, just thinking about this as well, from a behavioral health standpoint as well, part of the, certainly if it's prescribed by a doctor, follow doctor's orders, et cetera, that's always important. One potential consequence as well to using medication that is for erectile concerns without a prescription is that really, if we're using this tool to reduce the anxiety, for example, around this, then we're not learning necessarily that we can handle it on our own, right? We're not learning, we're then developing a confidence level that's based off of the medication rather than our own ability to handle it. It's possible that even without the medication, we could handle it and reduce our own levels of threat, gain comfort. But instead, we feel that we need the medication in order to perform sexually. And so then becomes this habitual thing that, doesn't allow the learning to take place without it. So just one potential caveat to using it kind of in a habitual way as well.
Gotcha. And I think that's a really important part that you bring up. Excuse me. Another part of that is that these stressors and things in life impact academics and impact other areas of life as well. But when we mention things like anxiety and stress and that impacts erection and sexual functioning, it's also important to know that these are very valid concerns, that if you're experiencing stress and anxiety and depression and those sorts of things, that's a very valid thing to be feeling. And that you're not in a minority, you're not in a place of something is wrong with you. It's a very common thing to be experiencing, at least somewhere across the board. In that same assessment that we did in 2019, we found out of the top 5 academic impacts that were impacting men, out of all these other things that they could be happening, stress, sleep difficulties, anxiety, and depression were 4 of those 5 top factors. So these are things that your peers are experiencing. While we may not talk about erectile concerns very often, they can be related to these things as well. And we're not really bringing these things to light as much. It's kind of the point of today's video, is to have these talks and have these things brought to light more. So it's important to know that college is a stressful time. COVID pandemic has been a stressful time. And then on top of that, there's all these other life factors as well. So if you're feeling stress, feeling anxiety, feeling depression, one, you should feel validated that this is not a unique experience, that it's something that a lot of people are also experiencing, but also note that we have the resources available here at UCSD and in the community to help where necessary. And if you'd like to reach out to find a provider at CAPS, we highly encourage you to do that. If you'd like to speak more about that, you could, and what that process looks like. But we have things here available for students. We want this to be something that we do talk about more. And if it's something that you are thinking you might be experiencing, some sort of a sexual functioning issue, please reach out. Reach out to your physician, reach out to your therapist, reach out to your counselor, and talk about these things. It's easier said than done to not be embarrassed about something or to try to not speak about it. But by taking the effort to actually bring it up with a provider who's there to help you, they might be able to help you find some different avenues for treatment, or even just a skill to learn, even just something else to do. It may not even be a medication. It may not be a treatment plan. It could be something very simple. And those are things that we would recommend as well.
Yeah, and just speaking from that perspective, and I mentioned this in another video we recorded, is oftentimes it's challenging for folks within, specifically male-identified folks, kind of within our society. You know, we've learned certain ideas about what it means to be a man, and masculine identities, and it's. The way I think about it is mental health is it's overall health. You know, we wouldn't stigmatize, if we were dealing with something else in a physical sense. And both of those things, again, go together. And, it's ultimately, let's do what works. Counseling and getting some other services and other resources is really, again, about getting tools to help us function at our best. And so I think it takes a lot of courage to admit, we need some support and get some support for that, and so we can function at our best, right? If there's a tool that we can use that helps us function better, let's go out and make that happen, and work better. If the tool you're working is great, then keep using that tool. If the tool is not working great, let's get some support with it too, so we can function better. Yeah, and CAPS is definitely available for that. You can you can reach out to a counselor at CAPS by calling. You can go on Google, type in UCSD CAPS. Their phone number is 858-534-3755, and someone from CAPS can help you get connected with a provider. Also, too, for students who have UC SHIP, there are providers in the community who can help with sexual health concerns as well, that can be covered by insurance and copays that are at low cost. So there are certainly many avenues and ways to get support.
And here at UCSD, we take a very holistic approach towards health and wellness, just like you were saying earlier, where, yes, we're talking about mental health right now, but it's so tied into all these other parts of health. We call them the dimensions of wellness. And those are things like your social well-being, your mental well-being, all these different areas make you who you are. And we can sort of look at these different health effects on all these different areas. On that note, just to have a quick overview, to look at things like nutrition, for instance. As of that 2019 data, about 3/4 of UCSD men were not meeting the nutritional recommendations for fruits and vegetables intake. So even something small like nutrition could maybe have an impact. For activity, less than half of UCSD men, it was close, but just slightly less than half of UCSD men were meeting those recommendations. So staying active, keeping that blood flow pumping, keeping our blood vessels used to having that blood flow going to different areas of our body, that can also be very useful. Things like sleep, making sure that you're rested enough to be able to function, not just sexually, but really anytime throughout the day. UCSD men were well above the average for being tired during the day after sleeping at least 3 days out of the week. So these are really, really common concerns that we're seeing on the whole health for UCSD men, not just sexually, but they all tie in together with that sexual health piece and the sexual functioning piece as well.
Yeah, totally agree. Absolutely.
That being said, that's all I've got for you today. Thank you so much for joining us. It's Men's Health Month, it's Men's Health Week, it's also Pride Month, so we're definitely covering a lot of things today. But we are so happy that you were able to join us. Keep an eye out for future activities that we're doing this year as well as next year, and we look forward to having you with us again. Thank you so much, Dr. McGlenn, for being with us. Always a pleasure and always very insightful.
My pleasure. Thanks for having me.
Of course. See y'all next time.
Take care.